Génesis CANELON was one of the millions of Venezuelans who left the country in recent years. She was living in Cúcuta, in Colombia, right at the border with Venezuela. But when the Colombian government imposed a lockdown, she decided to return home because she couldn't find work. The trip, she says, was one of the most difficult in her life.
They kept us in a station for 4 days with more than 500 people. There was lots of security and there was medical attention, but it was filled with people. I thought we were all going to get sick.
From there, they were taken to a school where they spent 8 days until they were put on a bus towards La Guaira, 30 kilometers away from the Venezuelan capital.
For 30 hours we were given no food or anything, and all the time we were being stopped by security forces. They wouldn't let us open the windows of the bus, and I was trying to grab them. When I arrived, I had to spend another 2 weeks in quarantine.
Génesis is just one of the thousands of Venezuelans who have returned, but authorities are not making the trip easy for them. Even though the government has repatriated people using humanitarian flights, there are thousands more who are trying to get back in by land. But border officials are allowing only 300 people a day 3 times a week. COVID-19 infections have been on the rise in the past weeks, posing a major challenge to Venezuela's healthcare system, which some say is on the verge of collapsing. President Nicolás Maduro accuses migrants of being used by Colombia's President Iván Duque to spread the disease.
We've proven the buses were contaminated so that Venezuelans would come back sick, and this was by the orders of Iván Duque. Venezuela is under siege and we're trying to take care of our border and our people.
But human rights groups say that's not the case, and abuses against returning migrants have put thousands of people at risk.
We've seen migrants being called biological weapons, carriers of the virus, and they are paying a price for leaving Venezuela. They're not given food or soap. They're in overcrowded places and shouldn't be treated like that.
Génesis CANELON says the ordeal to return was worth it. She's now back with her 2-year-old son. The challenge now is to survive in a nation where economic difficulties have become the norm. Teresa, Al Jazeera.